Why do sickle cell patients get pigment gallstones? Imagine your body constantly working to replace and repair itself. For people with sickle cell disease, this process is more intense because their red blood cells break down much faster than normal. This rapid destruction is called hemolysis, and it leads to a buildup of a substance called bilirubin. Bilirubin is a yellow pigment that comes from the breakdown of hemoglobin, the protein in red blood cells that carries oxygen. When red blood cells die quickly, they releases a lot of hemoglobin, which is then broken down into unconjugated bilirubin. The liver usually processes bilirubin by attaching it to other molecules, making it water-soluble so it can be excreted into bile. But in sickle cell disease, the amount of bilirubin produced can overwhelm the liver's ability to conjugate it properly. This excess unconjugated bilirubin then accumulates in the bile. When bilirubin levels in the bile become too high, it can start to crystallize. These crystals combine with calcium to form calcium bilirubinate, which is the main component of pigment gallstones. These stones are often black and are called pigment stones because they contain a lot of bilirubin pigment. Studies show that gallstones in sickle cell patients tend to be rich in pigment, calcium, and carbonate, making them different from the cholesterol stones more common in other people. The formation of these stones is mainly driven by the ongoing hemolysis, but other factors can influence the risk. For example, some people have genetic variations in the gene UGT1A1, which affects how well their bodies can process bilirubin. Variants in this gene can cause mild increases in bilirubin levels, raising the chance of gallstone formation. This is similar to what happens in Gilbert syndrome, a condition that causes slightly higher bilirubin levels without other health problems. Not everyone with sickle cell disease develops gallstones, which suggests that additional factors like bile flow problems, infections, or other genetic traits can also play a role. When gallstones do form, they can cause symptoms such as pain in the upper right abdomen, nausea, or complications like inflammation of the gallbladder or blockages in the bile ducts. These issues might require medical treatment or even surgery to remove the gallstones or the gallbladder itself. Because of this, regular monitoring for gallstones is often part of managing sickle cell disease. In summary, pigment gallstones in sickle cell disease mainly develop because of the constant breakdown of red blood cells, which leads to an overproduction of bilirubin. This excess bilirubin can crystallize and form stones in the gallbladder. Genetic factors and other biliary conditions can influence how likely someone is to develop these stones. If you or someone you know has sickle cell disease, it's important to work with healthcare professionals to monitor for gallstones and manage any related complications effectively. Always seek personalized medical advice to address individual health needs.